Hi guys, my name is Nicole and I had weight loss surgery, gastric bypass surgery, about 16 months ago. In the past couple of months I've had two more pretty major surgeries. They weren't gastric bypass or weight loss surgery related, but they definitely were impacted by my past weight loss surgery. There were a lot of considerations, a lot of planning that had to be made and done around my weight loss surgery so that I could have these other surgeries. So I thought I would make this video just to share with you some of the considerations that had to be made since I am a bariatric surgery patient in order to have other surgeries. Some things that I didn't even think about and just some things have come to light that I have to deal with for the rest of my life as a result of having weight loss surgery. And so, maybe you've had weight loss surgery or you're considering it. Hopefully this video can just help you be a little more prepared. So, I'm going to get a little personal in telling you what surgeries I had. And so, yeah, I hope that's okay. So just some stats for those of you wondering. I weighed about 224 pounds before I had my weight loss surgery. I'm down to about 114 pounds today. I had my weight loss surgery in October. It was October 27th of 2022. So I haven't had many complications from the surgery. I've had a couple episodes of gastritis. I have some bowel motility issues, but nothing major, thank goodness, knock on wood. But I am very careful in monitoring my diet, as well as making sure I get in all my vitamins and my supplements, hitting my protein goals, getting all my water. I do what I can to ensure that I continue to have a good recovery and a good outcome from gastric bypass surgery. But there are just some things that can't be avoided. But anyway, we'll talk about that in a minute. Okay, so the first surgery I had was I guess it's now been 11 weeks ago. So almost 3 months ago. Oh wow. Okay, it's been like 2.5 months. I had a total hysterectomy. Didn't want to have it, but had to have it. So going into it, in the pre-op stage, I was talking to the surgeon, and there was some concern about what antibiotic we'd be using because they usually give you a dose of antibiotics during the surgery. So this is not related to weight loss surgery, but I do have a lot of allergies to antibiotics. I'm allergic to like 5 major classes of antibiotics. It's really embarrassing and really annoying. One doctor very nicely once told me that I will probably die from an ingrown toenail at some point in my life because they just won't be able to treat me with antibiotics. So that's something to look forward to. But there are still some antibiotics I can take. However, the majority of the antibiotics I'm allergic to, I think all of them, I took successfully at one point and then developed an allergy. No, actually there is one antibiotic that I had an allergic reaction to the first time I took it, but anyway, that's neither here nor there. But anyway, so, we're talking about pre-op when I went in for my consultation with the surgeon, and she was like, well, what antibiotic can we give you? And so we looked, and I had gotten Ancef during my weight loss surgery and did fine with it. So the plan was to do Ancef again. However, it is a cephalosporin. I'm allergic to penicillins. It's a cousin basically to penicillin. And so there is concern that I will eventually develop an allergy to it. And so then, what they would do normally is give you steroids if you develop an allergy. But steroids are contraindicated when you have had a weight loss surgery. So there is that concern. I talked to my bariatric surgeon, and he was like, I don't want you to have steroids. And I was like, I don't want to have steroids either, but what if I have a reaction to an antibiotic? And again, he was like, well, you really can't have steroids. And I'm like, okay, I'm not going into it saying I'm going to have steroids, but what if I have an antibiotic, have a reaction, and need steroids? And he was like, I mean, if they need to save your life, they need to save your life and give you steroids. And I was like, okay. So that's one consideration. It might not be as big of an issue in your life, but I've been saved by steroids in the past several times. So yeah. there is some concern there. Of course, if I were to need steroids, we'd probably pump me full of proton pump inhibitors and other prophylactic meds to try to protect my pouch. And yeah, but I would need, I would have to have the steroids if it was a life and death situation. About a week before the hysterectomy, the medical staff called and, went over what meds I was on and whatnot. And they told me to hold all of my over-the-counter vitamins and supplements. And I said, I have to take these vitamins for my life because I had weight loss surgery, and they were like, oh, you'll be fine holding them for 5 days. They wanted me to hold them for 5 days before surgery. I should have checked with my bariatric surgeon. I didn't. I was just like, oh, it's only 5 days. I held them. So I'd had my labs checked about a month before the surgery, and everything was perfect. Had my labs checked the morning of surgery, and I was severely anemic. I had issues with anemia before weight loss surgery, but I've been doing fine since taking, my vitamins every day. But yeah, just 5 days, it dropped very fast. I was very anemic. I went right back on the vitamins after the surgery. We checked my labs a week later and everything was perfect again. So I guess that just really cements it in my mind that I do need to take my vitamins every day. Of course, they like most doctors these days don't like to give pain medication or much pain medication. So after the surgery, after the hysterectomy, I think they gave me, I don't know, like 7 pain pills. And then they were like, and then take ibuprofen for the pain. And I was like, I had weight loss surgery. I can't take NSAIDs. And so they were like, let's do Toradol. And I was like, that is an NSAID. I can't do that either. Oh yeah. And so it was decided I would just do Tylenol, which Tylenol does nothing for me. No. But I also don't want to take pain medication unless I need it. So I only took pain medication the day after the hysterectomy surgery. That's all I needed. It would have been great if I could have had ibuprofen and taken that because the pain that I did have was, of course, related to inflammation and, the pressure pain. And so it would have been really nice to be able to take NSAIDs. But I made it through without. I did take Tylenol. Again, it didn't do anything, but I felt like I should do something. I don't know. So I iced my belly a lot and just kind of took it easy. But I was back to work 3 days after my hysterectomy. Things were really easy with the hysterectomy. For a couple of weeks I would have some little twinges in my belly and just, a little bit of discomfort, but I took it really easy. And there were a few times I probably lifted more than I should have, but overall I think, I listened to what I was supposed to do and healed really quickly from it. So that surgery, I was really nervous about it, but overall it was really easy. I was on activity restrictions for 6 weeks. I could walk, just not walk on an incline or do any strenuous fast walking. I of course couldn't run. No lifting anything for a couple weeks, and then nothing more than 10 pounds for the full 6 weeks. But at the end of 6 weeks, I had my other surgery. Exactly 6 weeks after my hysterectomy, I had my right hip replaced, a total hip replacement. I've known for a long time I needed my hip replaced, and I know too young to have a hip replacement. No, but I have an inflammatory arthritis condition, and so I was first diagnosed with hip issues when I was 18, and it was 11 years ago when they initially wanted to do the hip replacement, but I didn't. I was like, well, I'm going to hold off as long as I can, and somehow I made it 11 years. The surgeon was like, your femur is about to collapse, or the head of your femur is about to collapse, and anyway, he was surprised I made it 11 years. He thought I'd maybe go 2 or 3 more years. But, so I was in a pretty bad way, and I went into him to get another injection, and he was like, we cannot do any more injections. This is ridiculous. You need this hip replaced. So, got my hip replaced. And he wanted to do it as soon as possible. I already had the hysterectomy scheduled, and so he was like, the soonest we can do it is 6 weeks. So we scheduled it exactly 6 weeks for my hysterectomy. So I never had the chance to be active again because I, of course, was then again on activity restrictions. Okay, so before the hip surgery though, in consultation with my orthopedic surgeon, he had the same concern about antibiotics. And so the decision was made to do Ancef again as well as vancomycin. I'd never had vancomycin, but I'd had other drugs in the same family and or other antibiotics in the same family and had done okay. So we were comfortable with that, but still with the same caveat that if I need steroids to save my life, I'm going to get steroids. But then he asked, he said that, of course, one of the biggest concerns after a joint replacement is clotting, blood clots. And so most of the patients, or he puts all his patients on aspirin for like a month after surgery. And so he said, "Are you okay with aspirin?" And I was like, "No, that's an NSAID." Then I was like, "Well, you're a doctor and I'm a nurse. I'm probably wrong." But no, aspirin is an NSAID. And actually I did some research and aspirin is more likely than ibuprofen to cause gastrointestinal issues. So it's even more important to stay away from aspirin. But anyway, so I had to work with my bariatric surgeon to see what I could take for, antithrombosis purposes to prevent clots. And so we decided on Eliquis. Eliquis is a lot stronger than aspirin, so then I had to be followed very closely by the thrombosis clinic. So they were calling me several times to make sure I was taking all my doses and that I wasn't having, spontaneous bleeding, that my eyeballs weren't bleeding or whatever. Interesting enough, I thought I would have lots of bruises from being on this blood thinner. Didn't have a single bruise. Kind of weird. Anyway, but it, I don't want to fault my orthopedic surgeon for not immediately thinking of aspirin as an NSAID, because I think most people think of aspirin more for its antiplatelet properties and, its ability to aid in blood thinning. And so that's primarily how aspirin is seen. And then it got me thinking, a lot of people, as they get older, they start to take a baby aspirin a day to prevent strokes and heart issues. And I have both cardiac problems that run in my family as well as strokes in my family, but I'm never going to be able to just take a baby aspirin every day for preventative measures. I never thought of that before. So that kind of sucks, because that's a really easy preventative, a really easy, cheap way to prevent serious health problems in the future. But that won't be an option for me. After the hip surgery, of course, I was given 15 pain pills. I went through those in 4 days. Hip surgery, everybody says it's so easy. It was not easy. I thought that I would be back to work. Well, okay, the doctor told me to take 2 weeks off work, and I was like, I'll be back after a week. I had my surgery on a Friday. I did take Monday, Tuesday, Wednesday off. I had to go in for meetings, go in virtually. I work primarily from home. So I had to be on meetings Thursday and Friday, but just for a couple hours those days. And then the next week I worked very part-time. I think I worked 16 hours. Truth be told, I could have taken 3 weeks off. That would have been ideal. I needed 3 weeks to recover from the hip surgery. It was very painful and just frustrating. But the majority of the pain was this pressure pain and just all the inflammation. Oh, this is the first time since I had surgery that I just wished I could take NSAIDs. I just really wanted to take ibuprofen. Now, there are different schools of thought. Some bariatric surgeons will say, an ibuprofen here or there isn't going to kill you. My surgeon is like, an ibuprofen at any time will kill you. My surgeon is very strict about NSAIDs. No NSAIDs. Absolutely no NSAIDs. No NSAIDs whatsoever. So I followed that guidance. Now, starting in week 4, I turned a corner. Everything was lovely, and I am I'm feeling really good right now. I'm 5 weeks out from surgery now, and I feel really good. And so I made it. I survived without ibuprofen, but I really think life in those first 3 weeks would have been so much better. I would have gotten sleep if I could have just taken ibuprofen. So, so other measures to relieve pain. First and foremost, mindset. If I let myself wallow in the pain, things were a million times worse. But I was constantly icing. for 20 minutes at a time and then 20 minutes off. But I had 3 ice packs that I just rotated. And I just was always keeping ice on it. You of course don't want to use heat because that's just going to promote more inflammation. It brings more blood flow to the area. I have the roll-on icy hot. I used that, like my back would hurt a lot, so I used that. I used like a whole roll-on tube of that icy hot. And then I, would just kind of manually massage, and it was very uncomfortable those first 3 weeks. NSAIDs would have been amazing. Of course, because I took pain medication for the first few days, I did have even worse constipation than normal. And without getting too TMI here, sitting down on the toilet's very uncomfortable when you've had a hip replacement. Like I got a raised toilet seat, one of those, I don't know, old people toilet seats. But even then, like just sitting down is so uncomfortable. And so to sit on the toilet and try to make things move was just awful. I was taking twice a day, stool softeners, and it was awful. Because I was so backed up and just because I just wasn't feeling well, I did not eat much. I lost 15 pounds in 2 weeks. I've put about 5 pounds back on since then, but I had gained a lot of weight over the holidays, so it kind of wasn't too concerning. But I lost that weight quickly when I wasn't eating, because of my weight loss surgery and just my body's inability to absorb, my body of course doesn't absorb as many calories now because of the, bypass portion of my intestines. So yeah, when I wasn't taking much in, I was losing weight very quickly. One of the worst parts of having these surgeries has just been the exercise limitations. Right before I had my hysterectomy, I had gone into running. Like, wow, I became a runner. Like, that's not me, but it was me. It was really me. But, I couldn't run after the hysterectomy until 6 weeks, and then I had the hip surgery, and now they don't really want you to run ever after a hip replacement, but they said that after 3 months, then I could probably run for like 5 minutes, maybe run like a mile at a time. So that's probably more like 10 minutes. But, no long distance running, just not strenuous running, which, okay, fine. Maybe I'll just run for a few minutes every day. I think that'll be plenty. But, I really like walking on the treadmill and bumping the incline up to 10 and just, walking as fast as I can, but I can't do any incline jet or anything till probably 8 weeks. 6 to 8 weeks, they said. And just, I really can't do too much. I can't do squats or anything like that yet. I have started doing my resistance bands for my upper body workout. They told me that until 6 weeks I should do those sitting, but I've been doing them standing. Oops. They have given me quite a few physical therapy activities to do, so those take me about a half hour a day, but they don't really get my heart rate up or anything. So mentally it's been really hard to go from getting to a point where I was pretty physically active and I was feeling really good about myself for the first time in a long time, and just really feeling how strong my body was and feeling what my body could do, to then, for now it's been 11 weeks, just kind of being not able to do any of that. I mentally feel very lazy, and it just hasn't been good for my mental health, if I'm being completely honest. But soon I'll be able to do more. Here I have marked down some things with my loose skin, or just skin in general. So with the hysterectomy, they did it laparoscopically. So they went in through my belly button, which they also went in through my belly button because they did my gastric bypass laparoscopically, as well as I had my gallbladder out a few years before my gastric bypass. So that belly button's been accessed a lot. But then they put 2 new laparoscopic scars in addition to the 5 or 6 that I had from the gastric bypass, and then I had 3 or 4 others from my gallbladder, and then many years back I'd had some lipomas removed. My abdomen is just a menagerie of scars. It's fine. It's just kind of interesting. It tells a lot of stories. There are chapters upon chapters written on my abdomen. And then for the hip surgery, they did an anterior approach. So from like my bikini line and down, I have an incision about that long. It's pretty well healed now, but it looked kind of funny at first because of all the saggy skin there too, just the way they sutured it. I don't know. I thought it was going to look terrible. Now that it's healed, it looks pretty good actually. But like the bandage, when they were trying to take that off at my 2-week post-op, it was really pulling my loose skin, and it was really kind of bizarre. I was telling the MA, I'm like, you can pull more, it's just the skin's gonna pull a lot because there's just all this loose skin there on my thigh. Yeah. One interesting thing when I was in the hospital, so both surgeries were done outpatient. They were gonna keep me after the hysterectomy, but I convinced them to let me go home because I didn't want to be in the hospital anymore. After the hysterectomy, they had moved me to an actual room. After the hip surgery, we had planned ahead of time that I was going to be outpatient. And so they just moved me back to the same-day surgery room, so it wasn't like a real full-on setup. But after the hysterectomy, when I was in an actual patient room, like they brought me a full-on, patient dinner, and everything was so carby and just not like the high protein meals I try to eat. And then when I got out of the hip surgery, they brought me snacks. They brought me cookies, and they brought me graham crackers, and they brought me saltines. Not a protein inside. So that was interesting. And it was a little, I don't know, I was like, should I eat all these carbs? And then I was like, oh my gosh, what if I dump here in the hospital as I'm trying to recover from this horrible surgery? Anyway, it was fine. I did fine. But it was just, even working in the hospital, like I never really noticed how carb heavy all the meals are. So some positives though from having the weight loss surgery and how that impacted these surgeries, I feel like I recovered a lot better being at a healthy weight. I used to work for a neurosurgeon. I was a nurse, and he did a lot of, or I am a nurse, I was his nurse. He did a lot of spine surgeries. And unless it was an emergent situation where like a person was becoming paralyzed, he would not operate on somebody with a BMI of over 45. And that wasn't just his rule, that was like a hospital rule, because the beds weren't safe if you were bigger than that, and the tools. I mean, imagine you're operating next to your spinal cord. The surgeon wants to have as much control over the tools as possible. And if you have this big tool, because you have to get through all layers of fat and tissue, then the farther you are away from the contact point, you're losing control of that tool. And so if you were over 45 BMI, they would not do it. Over 40, there has to be a good reason to do it. So these surgeries, I don't even know if they would have done them if I was at my highest weight. Because, I mean, I wasn't quite at 45 BMI, but I was 42 or 43 maybe. But, was I that? Yeah. So yeah, I might not have even been able to have the surgeries, but just the recovery as well. Like, I can't imagine having been as obese as I was and trying to move around after my hip replacement. Ugh, that would have been really difficult. So I'm very, very glad I was at a healthy weight to have these surgeries. So some tips that I would give to people who are maybe going to be having surgery after they've already had weight loss surgery. Prepare food ahead of time. Make sure that you have foods ready to go, because you don't want to be having to be cooking or going grocery shopping after you had surgery. Make sure you have protein options. Make sure you have water available. Talk to your weight loss surgeon before you have surgery to see what they recommend. And don't just go with what the other surgeon's saying, because even though your other surgeon, I'm sure, is very qualified in their area, they may not know a lot about weight loss surgery. They may not think, oh, an NSAID or aspirin is an NSAID off the top of their head. Ask about holding vitamins. So I didn't hold my vitamins with my hip surgery. They didn't tell me to. And I didn't even ask if they wanted me to, because I was like, I'm not getting into the anemia territory again. I'm just going to keep taking my vitamins. Stand firm if your surgeons try to give you NSAIDs. So when I was in the recovery room for after my hip, like I had just come out of anesthesia, and the resident came over and he was like, well, let's give you some Toradol. And I was like, no, Toradol's an NSAID. I can't have NSAIDs. Thank goodness I was cognizant enough to think of that. But he was like, oh, it'll be, one dose will be fine. I was like, no, I just do not want to take NSAIDs. Because like I said, my bariatric surgeon is very much no NSAIDs. But other surgeons might be like, one time, you'll be fine with one dose. But anyway, I stand firm. So my other tip is to stick with your PT and don't try to push things. Let your body heal, take your time, just do the PT, the physical therapy that they recommend, and just know that you're gonna get better. Start taking stool softeners a few days before surgery so that things are really nice and regular before you introduce in pain medication to really screw up your routine. And of course, drink your water. Ice. So buy ice packs. I'll link a couple down in the description, and I'll show a picture here of what I got off Amazon. Like if you're having a hip replacement, these were genius hip ice packs, I thought. And then I got this other ice pack that I'll show here. That has just been tremendous. Anyway, I had 3 ice packs, like I said, just in rotation, and they were really great. Have a plan for elevating. You really want to make these plans for how you're going to control your pain. Now, both of my surgeries, the hysterectomy and then the hip replacement, elevating wasn't really practical. Like, I elevated my legs in general, but your hip, like, you'd basically have to stand on your head to get your hip elevated above your heart. And I did not do that. And then same with the hysterectomy, like, yeah. But ice and what elevation I could do were my 2 main techniques for pain control, as well as staying in a healthy mindset. I watched a lot of comedies on Netflix. And then just give yourself grace and time to heal. Like, again, my 3rd week after that hip replacement was so rough mentally, because I just felt like I worked so hard to get to such a, to a place in time, a point in time where I like to exercise and I like to feel strong and like seeing what my body could do, and I felt like I was just like a slug laying around. But just be nice to yourself and know that you're going to get past it. Things are going to improve. You'll get back to being active, Nicole, one day. One day soon. No. I'm back to walking on the treadmill. I walk on the treadmill. I did start to do a slight incline. Not really supposed to do that for another week, but I've started. But I'm on the treadmill for 15 to 20 minutes at a time now. And, I do about a half hour, like I said, of the physical therapy activities. I'm back to using my resistance bands for my upper body. I'm getting there slowly but surely, and it's feeling good. Okay, so that's all I have for you today. Hopefully this video, gave you some information on what you can potentially expect when you have surgeries after having weight loss surgery. Even if those surgeries are not related to weight loss surgery, your weight loss surgery is still going to impact many things, many facets of those surgeries. But like and subscribe, watch my other videos if you care to, and I will catch you guys in the next video. Bye.